Hi, okay. Here we are. I'm Leann. I'm excited to be here. I love this day. I have been to all of the Days with the Experts since 2007. So I am happy to be here. So we're going to be talking about autism later in the life course. And I hope I don't bore you too much with too many slides, but I have a lot of data I want to share today. So why are we discussing autism as people age? Well, we want to understand aging as a process. So there's not like a crisp age where now you're old. It's a process and that I'm experiencing myself. And we also want to think about how we can support healthy aging for autistic adults to inform clinical care services and public policy. And we want to address questions that autistic adults, their families may have about what to expect in the future based on what we know from research. So first, I want to say, does anyone know or has heard of Donald Triplett? Just raise your hand. Okay, all right, very good. So some of you know, but some of you may not. Donald Triplett was the first person ever diagnosed as autistic. And he recently passed away at the age of 89 after having lived a really full, independent life that involved playing golf almost every day into his 80s. He worked at a bank, he traveled the world, had a really seemingly great life. He's received a lot of media attention. So you could Google Donald Triplett while you're here or later and learn more about him. There's a PBS documentary about his life that might be of interest. But what's really important to think about is Donald Triplett's life something that is we're going to expect for all autistic people, or what might be sort of the individual courses of aging that different people might have? And I think for all of you to know, particularly families, Donald Triplett's really wonderful quality of life is a great testament to his own resilience, but also to the passion and commitment of his family. His parents, interestingly enough, they're really meticulous notes about their child and his behavior when he was very young is what formed our definitions of autism today. So their notes, their advocacy, their awareness of his unique differences are part of how we even define autism. And so I think it's a really interesting story, but important for us to think about well, all autistic people have a course in aging like Donald's. We don't know, so we need to look to research. So our goals for our time today that I have, just a little bit of time with you, I want to talk about what we know about aging and autism from our very long, over 20-year longitudinal study of autistic adults and their family members. This study has been funded by the National Institute of Aging as well as NIMH and Autism Speaks. I'm really grateful for the very long-term commitment from NIH to support this science. We want to consider how autistic adults, their families, and service providers can start to plan for the future and be responsive to the changing needs during midlife and older age. So I'm going to emphasize this a lot, is that the needs of autistic individuals do not stay the same from when they are 18 to 80. So I've already told you the punchline of the talk, but I'll keep reiterating that. Also, just as a caveat, and I'll give some more caveats, it's important to recognize that I'm talking about people who are autistic adults today. Future generations of autistic people might experience their aging differently. Old age in the same way not everyone may look like Donald Triplett. Older age may not look the same for people that are children that are being diagnosed today, because there are different programs, services, et cetera. So our Adolescents and Adults with Autism study, the AA study, was started by Dr. Marcia Malik in 1998. So before I came to the Waisman Center, and I've had the joy of being able to join in and be a part of this study since I've joined our community here. It started as a very large sample, over 400 families of autistic individuals and their multiple family members. And the child at the start of the study in 1998, the children ranged in age anywhere from 10 years old to 52 years of age. And so when we follow people for 20 years, it means we now have people that are in their 30s up to 70. So it's a really nice way to have to be able to look at that whole life course together. And here you can see we've collected data 9 times over a 22-year period. We're still an ongoing study, so we're going to be collecting another round of data very soon. So we are proud to have done this for such a long time, and really deeply grateful for the families who have participated in this work for such a long time, because we could not know what happens to autistic adults if the autistic individuals and their family members had not made this huge, in my mind, contribution to society by participating and help us to know how autism changes over time. So a few caveats again about this particular set of data. All of the autistic individuals in our study were diagnosed before the expansion of the autism spectrum that happened with the DSM-5. So these were individuals that received an autism or an Asperger's diagnosis actually when they were children in the 70s or 80s. So these are individuals that absolutely are autistic, but maybe don't reflect the widening of the autism diagnosis that we've had more recently. All were recruited with their families, so it's a multi-generational study of aging. And unfortunately, our sample has little racial or ethnic diversity, but a significant amount of socioeconomic diversity in terms of educational and income levels of families. And again, we are just starting our journey of learning about aging and autism. So it's really important. I'm going to share some findings, but these are tentative and we'll need to have replication with other samples and with autistic people that have been born or diagnosed more recently. But all of those caveats aside, I think we have some interesting findings to share. So our research questions, we're thinking about, can we understand the trajectories of behavioral functioning and health over a 22-year period? Do these trajectories differ for those who have an intellectual disability in addition to their autism versus those who don't have an intellectual disability co-occurring with their autism? So when I say there's not an intellectual disability, it means they have an average level or even a higher level of intelligence. And that's one of the, when we think about how big, like Lily was saying, that the phenotype of autism is really big, thinking about those who have a co-occurring intellectual disability is one way to try to understand that really big range of autism. So for this particular study, which led by Jinka Kong, we were able to make one big trajectory over that age 10 to the almost age 70 over time by taking each person's individual journey over that 20 years. So one person would be from age 10 to age 30, another person would be age 20 to age, oh, I've got to do the math, 40, age 30 to age 50, if that makes sense. And you add them all together to make one arching trajectory, okay? And we looked at a variety of different domains that were of interest in the literature and maybe of interest to families, looked at communication, particularly verbal communication, social reciprocity, which is sort of engagement and the back and forth interactions with others. For health, we looked at the number of prescription medications autistic individuals were receiving. In terms of behavioral health, we looked at internalizing, externalizing, and asocial behavior. So internalizing things are like feeling anxious or depressed. Externalizing would be sort of the outside, more aggressive types behavior. Activities of daily living, we looked at self-sufficiency, so level of independence and hygiene and preparing food, managing finances, purchasing items, shopping, those types of activities. And then for social participation, we looked at the time spent with friends or neighbors, and this could be, several times a year, maybe to several times a week. And so we looked at all of those different things. And again, for each of those, we wanted to see what was that trajectory sort of across the longer course of life in adulthood. So what did we learn? And I'll give you the specifics in a second. But basically, we see different patterns of change across adulthood depending on the outcome we're interested in. I just gave that list of different outcomes. So for some outcomes, we see sort of steady improvement across adult life. So things actually just kind of get better as people age. For other areas of life, we see across adulthood, there's some worsening over time. And then for other areas, which maybe is like our main pattern, is that there's a lot of improvement, gains in skills during adolescence and young adulthood, but there seems to be a pivot point at midlife where some skills are lost or there's some worsening at midlife and beyond. And again, I'm just giving you lots of caveats, so be patient with me. There are lots of individual differences. I'm going to show you the average trajectory across people, but every person has their own little journey. And so these are just the averages. So as I said, there are some things that just seem to get better. Communication is one of the areas that we just see improvement. Now, I'm going to take some time, and does this, I don't know how to use this. Oh, good. Okay, this is great. So I'm going to take some time to show you these graphs, these figures, because I'm going to show a bunch, and so I want you to be oriented to them at first. Okay, so you see here, there's the 10, and we go across the x-axis up to the late 60s. So this is how old people are. So they're 8 years in age. And here, up here, higher for this particular graph means worse communication, and down here is better communication. So it's a little counterintuitive. But and then the red line are people with autistic people who have co-occurring intellectual disability. And the blue line are autistic people who have average or higher than average intelligence, but they're autistic, okay? And so you can see that for all the autistic people in our sample, as they age, their communication improves. So this is an encouraging story of sort of improving in communication, and particularly for those who have average intelligence, their rate of improvement is faster, but sort of the whole sample is improving over time. Okay, so now I'm going to show you other domains. So the next area is social reciprocity. Again, that sort of back and forth engagement and interactions with other people. Here, 10 up into the 60s is how old people are. And again, higher scores on this measure are worse and lower scores are better. And for those autistic individuals with an intellectual disability, over time, their social reciprocity is flat. So it's stable. So it doesn't get better, but it doesn't get worse, okay? For those who do not have an intellectual disability, so those were average or higher than average IQ, we actually see a steady improvement in social reciprocity as they age, moving from adolescence across into older age. So this is sort of both a story of stability, but also a story of improvement. Next, this is a story where things get worse, but maybe not too surprising as we all age. So here, again, at the bottom, 10 up into the 60s. For this one, this is the number of prescription medications. So higher scores mean more total medications that the autistic person is taking. And for both those with and without intellectual disability, there is a steady increase in the number of medications that are being taken as people age. What's important to point out is that there's this term called polypharmacy, where if you're taking multiple medications, perhaps for the same condition, if you're taking 5 medications or more, that would meet the sort of, well, there's debate about the exact definition, but would meet a standard for polypharmacy. And when you're experiencing polypharmacy, it might be really appropriate and good and what is needed, but it also might put you at risk for having drug interactions or side effects that might be difficult for you. And excessive polypharmacy would be above 10. These are the average curves. We have some people in our sample that definitely are exceeding that polypharmacy line. And almost everyone in our sample, by the time they're adults, are taking um, medicines. And you can see that the individuals with co-occurring intellectual disability, they're crossing that polypharmacy line sort of early in their 40s. Those without intellectual disability do cross that polypharmacy line, but it's later. It's in their early 50s. And many of us might be experiencing polypharmacy, but typically this is something that you would think about happening at older ages. And so this is something we think really we should be thoughtful in working with our physicians to think about our medications, and particularly, are there any sort of interactions that might be happening from these? Some of our earlier work, just so y'all know, that in this sample, you're much more likely to stay on a medication or a class of medication once it's prescribed than to stop. So 17 times more likely to stay on a medicine once you start that medication. And so particularly for adults, I think that's probably why we're seeing these sort of increases in the number of meds over time. Okay, next. Now we're going to talk about behavioral health. Remember, that was internalizing, externalizing asocial behaviors. Here, again, 10 to 66 is the age. Higher scores are worse. Lower scores down here are better. And this is a situation where during adolescence and young adulthood, it's getting better. So for both those with and without intellectual disability, there really seems to be sort of improvement in behavioral health on average. And again, it's the big curve. Any given sort of year, you might be up or down, but sort of the trend is moving towards improving behavioral health as people age, moving really until we hit sort of this midlife point. And then it's sort of that improvement of behavioral health slows down. And what we're seeing is that as people are sort of leaving midlife, moving towards older age, there does appear to be potentially an uptick in behavioral health problems as people are getting older. And that is both for those with and without intellectual disability, and there aren't really differences between those with and without intellectual disability here. So this is one of these sort of mixed stories. Here's another mixed story for you. Again, 10 to 66 is the age. Here, higher scores are better, lower scores are worse. Higher scores mean more daily living skills that can be done independently. And again, these daily living skills are things like preparing food, self-care, personal care, and doing some, some things with money and that sort of thing. So as you can see, and this is we had published some data like this over 10 years ago now that maybe actually presented to all of you at this meeting many years ago. And then we collected another 10 years of data, and it's even, the finding is even stronger. So I feel pretty confident here. So I'm going to talk about the blue line first because it has the biggest curvature. So the blue line, again, are autistic individuals who have average or higher IQs. And you can see that during adolescence and into the early 20s, there's a really big jump in the number of things people can do independently, and their daily living skills really improves. The same thing for those with intellectual disability, although that jump or the number of things they're doing independently isn't as much as those without intellectual disability. But what happens, it's almost as if someone is putting the brakes on those gains by the time people are really, you can see sort of the brakes are starting sort of in the 30s. And it's almost like someone is slowing down those gains, which might make sense for people who are adults. There's maybe, sort of we've reached our number of things we're going to do independently. But what's concerning, and again, it seems a pretty steady finding, is that there seems to be a loss of some skills that people are able to do as they're moving into midlife. And so, again, there's a lot of gain and growth, but then at sort of midlife and moving into older age, there may be a loss of some of these skills. And it's both for those with and without intellectual disability. Next, I'm going to talk about, which is time spent with friends and neighbors, so sort of social time. And it's the same sort of scale from 10 to 60s for how old people are. Here, higher scores mean more time spent with friends and neighbors, so more frequently doing social interaction. And the pattern is very similar for those with and without intellectual disability, where we see an increase in socialization or spending time, social time, through through the 20s and into the 30s. But again, it's if someone sort of slows down, sort of those increases in socialization and which might make sense. But we're seeing as people are moving into midlife and then older age, a reduction in the amount of time that they're spending time with friends and neighbors. And I'm showing you all of these things because I'm not saying we don't know sort of what's predicting what, but they all are sort of occurring together, right? These changes. So it raises the question, is midlife a turning point for autistic adults? And I think it might be, and not because we're seeing these sort of pivot points in terms of behavioral health, self-sufficiency, time spent with friends and neighbors, and also maybe this concern about polypharmacy that might be happening. I'd just toss in a little comment about work and what are people doing as they're aging during the day. Because this also might be of interest to some of you. So we see that we were able to categorize the types of activities people were doing during the day in our sample over this 20-year period. Interestingly, when you looked at all of the data over time, about 15% of our sample didn't have a consistent pattern. So they were in and out of different types of activities, which often would include periods of not having any activity. And so you could think of that there's just a group of autistic individuals where their sort of adult activities are pretty unstable. Okay. Almost 40% of autistic adults that didn't have an intellectual disability, so average intellectual functioning, had sustained competitive employment, not necessarily with the same employer, not necessarily for a ton of hours, but sort of across that 20 years were pretty consistent. On the flip side, about 20% were consistently doing nothing, so not engaged in sort of vocational activities. For those autistic adults with intellectual disability, they did seem to have an employment safety net. So they were able to engage in agency-based or some sort of supported community employment. That's about 75% of that group. So that, I think, is encouraging. And there were about 10% of those autistic individuals with intellectual disability who weren't really doing any sort of regular activity. But we don't really know a lot about retirement. We wonder if perhaps there are some people that are entering sort of retirement phase early, but we really need to probe that and explore that in the data. So this is an area of research for us in the future. So just some conclusions, and then I'm going to give some recommendations. So adulthood is not a static time of life for any of us, including autistic adults. Again, sometimes we think 18 to 80 is the same thing. And like we're so focused on the 18 months when you get a diagnosis till you turn 18. But there's a huge part of life where we're adults and autistic individuals. We need to understand that really the multiple decades of life, and it's not static. Adolescence and young adulthood is a period marked by some key gains. So, and some of these gains that we see are made during adolescence and early adulthood are maintained. However, for some other domains, it does seem like midlife is a pivot point where there might be increasing risk, that there might be some signs of sort of aging effects that are happening that could begin in the 30s and 40s. And in older age, we do see some of these reductions in behavioral health and social engagement, and we need to try to understand these factors more. So what are some things that we could do? I think we could think of, and thank you to Marcia Malik for this conceptualization, that midlife might be a time for like early intervention. So before we enter into that process of older age, might midlife really be a place that we need an infusion of services and supports for autistic individuals to help have enhanced healthy aging in the same way that we provide intervention services at other ages. And so when we think about what might those sort of early interventions be, we really should think about the personal priorities for the autistic person for their quality of life. And it may be different than what I might decide or someone else might decide. And what matters now to the autistic individual, and can we envision what might matter to them in their future, and then make plans accordingly. We want to engage siblings and other family members. I'm not showing these data now, but we also see that the mothers of the autistic adults, they are experiencing their own health declines and aging. And so can we think about other people to be a part of the team? We want to focus on maintaining independent skills and social engagement as we can, because we have some other research to show that does help. These outcomes can be interconnected. And then for financial planning, we need to be thinking about wills and trusts and things that you think of for aging, and autistic people should have sort of these plans just like other people might. And it might be a good time at midlife to do a health audit. So are all of these prescriptions needed? Are there any drug interactions? Are we getting regular health screening? I know that sometimes autistic individuals, because of barriers in our healthcare system, maybe aren't getting routine cancer screenings and things. So can we be really thoughtful about making sure that those things are happening? And then let's think about the broader context and where are people living? What is the community? Are these places where sort of aging in place or healthy aging is going to be able to occur? So I will wrap up there. Just again, thanking everyone, particularly Marcia Malik. I know Renee is here, our amazing project manager. Just really thankful for those who contributed to these studies I'm talking about here, and all of the families who, again, it is a real gift to the next generations that they have provided this information to help us understand the future. So thank you very much. And Teresa, I don't know if there's like a minute for a question.
Yep, we have some time for questions. I know there's a question from the chat.
Okay.
And that was, what is the difference between behavioral health and mental health?
Yeah, so this particular measure, and the reason I was using behavioral health is that the measure was measuring sort of behaviors as opposed to, it was not a measure of the autistic adult's report of their depressive feelings. So it was more about the behaviors that would indicate behavioral health than it was their internal symptoms. Yeah.
I have a question and then a quick comment.
Great.
All the people in your longitudinal study were diagnosed as children, if I understand correctly. Mm-hmm. Have you looked at people who were diagnosed as adults?
Yes. So I think that's a great question. And some of work in other labs have been looking more at individuals that received a more recent diagnosis during adulthood. Our study, since we started in 1998, we weren't really diagnosing autistic adults in 1998. And again, so these are individuals that they were diagnosed as children a long time ago. But I think there are other labs and other groups that are starting to probe that. Some of our work looking at electronic health records, which we've been able to do, that includes adults of any age, diagnosed, received. And we do see differences in health outcomes for autistic adults compared to non-autistic adults when we look at sort of health conditions at these later ages. But I don't have anything like this study for what you're describing. Yeah.
And then just a comment, for all the graphs and charts and conclusions that you showed, I would have found it incredibly helpful to have the same measurements for non-autistic people. Without that context, it's hard to draw any conclusion. For me at least.
Yeah. Thank you.
Leann, the one question I had.
Oh, it's Nancy. Okay, I can't see you now. I see you.
Yeah, is these charts that show increase in functionality and then some slow decrease in older ages. Has that been compared at all with like the trajectory of people who are neurotypical? Is that very much different?
Yeah, thank you. And I will, so I probably should have shown this. So we also have a study that is midlife in the US that's led by different investigators here at UW-Madison that has data that looks at life course trajectories of aging for many different people, which can include autistic people, non-autistic people. And I do have some curves there that would suggest that there may be some accelerated differences for autistic people. But again, I didn't put those up. But I think that's a great point, Nancy. Thank you.
I was just going to ask, kind of based off of what Nancy was saying too, do you think that could just be the lack of support from like the parents and the families? Because at the same time, it looked like the decrease in like friends and family members being around. So those kind of combined is kind of.
Yeah, that's a great hypothesis that I think we want to test. Again, I didn't show this, but we have the mothers from the study and their health and their engagement and things. And we do see that there's a difference between mothers of autistic adults and mothers of non-autistic adults, and the age at which different health conditions emerge, with mothers of autistic adults having those health problems sooner. And so that may be part of why we're also seeing sort of the differences in time. But I didn't line those up and for this talk, and those are analyses that we definitely need to do. Thank you. Yeah.
And just one other follow-up on that is just the question of whether or not some of the changes as people age post midlife is just an inability or non-interest in masking.
Mm-hmm. Yeah, that's great. And I think that I would, because we're still collecting data, masking was not something we were talking about 20 years ago. And I think that would be a really good question to include in this sort of next series of sort of studies, is to understand perhaps that is part of what we're observing. That's great. There's some questions back
Any other
there.
questions?
Okay.
Hi. So I had sort of two questions. First one on the note of employment, because you did note that there's sort of a gap between like autistic individuals with average or high intellectual functioning versus people with co-occurring intellectual disabilities. So there's actually lower employment. And I was wondering if you guys looked into it all, like workplace accommodations or like attitudes towards autism, just from my own like anecdotal evidence of knowing autistic adults. They find a lot of hostility towards asking for accommodations and unmasking. So then they find it much harder to hold employment because they're like being held to neurotypical standards or even higher.
Exactly. Yeah, that's great. And we have a whole other study funded by NIH where we're looking specifically at employment among a younger sample, so people in their 20s and 30s. And we've just been working on an analysis looking at the sort of pros and cons of disclosure for the same reasons you're discussing. And one of the things that we're finding in that younger sample is that the workplace climate matters a ton. It really matters for how people feel about their jobs, how satisfied they feel, that sort of sense of, so climates that feel safe and that you can talk to your colleagues or your supervisor and you can be yourself and you feel accepted. That's really important, and some preliminary data, we've not published this yet, but might suggest that that is important for stability in that job, that specific job over time, right? So that you might be able to stay in a job longer when it really is an environment that is supportive and accepting. So I don't know if I answered your question, but I think I'm on the same page with you. We have this other study where we're trying to probe that.
So you would say that if there's a better environment, you have higher stability, and then generally these life metrics are going to be better and worse and less in later life.
Yeah, and I think that, again, there's so many caveats with what I show, but one is that I just had to show you the average because I'm, adding all these hundreds of people together, right? And that any individual might be different. So I don't want to promise what one person might experience, but I do think that some of the earlier work we've done, like being included in school, being included in your community, those things can matter for the outcomes we're talking about, including employment. And that people that have sustained employment coming from an environment that's more inclusive has been shown to be helpful. So, yeah.
I guess really quick, second question. did you do any like sex specific analysis? Because I know something I've heard about is like menopause really affecting presentation in like autistic women and often spurring diagnosis if they're not already diagnosed because they go through menopause, hormonal changes, and they kind of like freak out, and that results in them seeking diagnosis. So I was wondering if you noticed anything along that line.
Yeah, no. So I'm actually interested in writing a grant with these exact sort of questions. I don't think that we, because so much of the autism research that's been funded, just for y'all to know, like less than 10% of autism research is focused on adult, transition and adults. So we have very little research. And then autistic women in particular have been understudied. And so I think we have a lot of hypotheses and potential trends like autistic women are more likely to decrease in their employment over time in some of our studies we've found. But tying that to hormonal changes, we just haven't been able to probe those specific questions, but I think they're really important to understand. And again, there's not been enough science devoted to autistic women, particularly as they age, to be able to answer those questions yet. And I hope to. Thank you.
Yeah, thank you.
So just so that we have time for our community panel, I think we're going to transition. So thank you so
Thank you.
much, Leann.